Hello everyone, I am Narendranath Epperla from Ohio State University, and today we'll be discussing about an important topic, which is POD24 in indolent non-Hodgkin's lymphoma. As we all know, it has been almost 7 years since the pivotal study that was published in the Journal of Clinical Oncology, JCO, back in 2015 by Dr. Cosullo and her colleagues. In that study, they showed using National Lymphocare database that patients who progress within 24 months of diagnosis have inferior outcomes compared to those who do not. There were two important things to note in that study. One, majority of these patients received R-CHOP as their frontline therapy. And two, more importantly, the data was independently validated, arriving at the same conclusion. Since then, these group of patients within the follicular lymphoma have been identified as a high-risk subset, and several trials have been designed targeting this group of patients, and rightfully so. What about the data in marginal zone lymphoma? A few years ago, there was a study that was published by Dr. Luminari and his colleagues in the blood. They used PHIL NF10 database, which is a prospective study, and showed that the patients who progressed within 24 months from diagnosis had poor outcomes as well compared to those who do not. It is important to note that in this study, they only included or considered the patients who received immediate systemic therapy and progressed within 24 months as the POD24 group. In that study, they showed that the 3-year overall survival for patients with POD24 was around 55% compared to those in the non-POD24 that was over 90%. Similar trend was noted in among the subgroups, that is, patients in extranodal marginal zone lymphoma, nodal marginal zone lymphoma, and splenic marginal zone lymphoma all had inferior outcomes in those with POD24 compared to those without. However, the most important thing to consider is that not all patients with marginal zone lymphoma require immediate systemic therapy. In fact, it is most of the patients in marginal zone lymphoma have variable time to initiation of systemic therapy, and there are no universal guidelines to help define the timing for initiation of systemic therapy. Hence, we sought to evaluate the impact of POD24 in marginal zone lymphoma patients using a multi-center US-based cohort study. In this study, we defined POD24 as the time from initiation of systemic therapy to the time to progression. So in the patients who had progression within 24 months of initiation of systemic therapy were defined as POD24 in our study. The study included patients from 11 academic centers across US, and we had a total of 524 patients. Among these, 143 patients were in the POD24, so roughly constituting 27%, and 384 were in the non-POD24 group. The median age was 63 years. A greater majority of patients in the entire group were splenic marginal zone lymphomas. They constituted 50% of all these patients, and with a rough 50-50 split between the extranodal marginal zone lymphoma and nodal marginal zone lymphoma. Compared to non-POD24 group, a significantly greater proportion of patients in the POD24 group had ECOG performance status of 2 or higher, LDH above the institutional baseline, low albumin, monoclonal protein at diagnosis, and received rituximab monotherapy as systemic therapy. we saw that the patients in the POD24 group had significantly inferior overall survival compared to those in the non-POD24 group. The 3-year overall survival estimates was 83% in the POD24 compared to 97% in the non-POD24 group. And when we looked at the 5-year overall survival estimates, they were 75% in the POD24 group and 92% in the non-POD24 group. In order to account for guaranteed time bias, or in other words, immortal time bias, we also performed Simon-Markach analysis or curves, generated Simon-Markach curves, wherein all the patients start in the non-POD24 group, and when they have a progression, it is considered as the event at risk. They automatically drop into the POD24 group. This analysis accounts for immortal time bias that could be generated in conventional Kaplan-Meier curves. We noted that when we did the Simon-Markach curves, the patients in the POD24 group had significantly inferior overall survival compared to those in the non-POD24 group, with a p-value defined by Mantle-Bayer analysis, which is a Mantle-Bayer p-value that was less than 0.0001. When we looked at the subgroup analysis, similar trend was noted in the patients with extranodal marginal zone lymphoma. However, though the patients in the nodal marginal zone lymphoma and splenic marginal zone lymphoma had inferior survival in the POD24 group compared to the non-POD24 group, this did not reach statistical significance. It's also important to note that regardless of the first-line systemic therapy, that is our single agent or our monotherapy or immunochemotherapy, POD24 group had significantly inferior overall survival compared to non-POD24 groups. We also looked at the factors predictive of POD24 group and did a logistic regression analysis and noted that the patients who had monoclonal proteinuria diagnosis and received rituximab monotherapy as their first systemic therapy had increased odds of POD24. Lastly, we looked at the cumulative incidence of transformation and noted that the patients who were in the POD24 group had significantly higher incidence of histological transformation compared to the non-POD24 group, with a 3-year cumulative rate of transformation being 12% in the POD24 group versus 1% in the non-POD24 group, and the 5-year rate of transformation being 37% in the POD24 group compared to 2% in the non-POD24 group. Thus, we show that POD24 defined as time from initiation of systemic therapy to progression within 24 months is associated with inferior overall survival compared to non-POD24 group and represents a very high risk subset of marginal zone lymphoma patients. These patients need to be prioritized for cellular and immunotherapies. More importantly, these patients have a higher risk of transformation. Hence, it is recommended that these patients undergo biopsy at relapse to rule out histological transformation. Thus, putting all these 3 studies together, I feel that the POD24 is an extremely important clinical marker for identifying high-risk subset, be it in follicular lymphoma or marginal zone lymphoma. Thank you so much for listening.